It was 2 a.m. in the oncology wing of a Chicago hospital. The only sounds were the beeps of monitors and the soft squeak of shoes. Gary, a retired firefighter, lay awake, not from pain, but from a deeper fear. Machines measured his life in numbers but couldn't touch his turmoil. Lulu Reyes, a Filipino nurse, entered quietly. She checked his vitals, adjusted his pillows, and saw the suffering in his eyes. A loneliness no medicine could reach. Instead of leaving, she sat by his bedside in silence. Then she asked, "Mr. Gary, may I offer a small prayer for you? Not for a cure, just for peace." Lulu prayed quietly, a humble act of connection from her village in the Philippines. In that quiet moment, something shifted. For the first time in weeks, Gary felt a flicker of peace. Sometimes the most powerful medicine is simply not leaving someone alone in their fear. Dr. Evelyn Lee expected Gary to be agitated, but he greeted her with a weak smile. "Morning, Doc." Over the next days, Gary's peace remained. He reconnected with his family, and his wife thanked Dr. Lee, saying, "It's like I have my husband back." Dr. Lee watched as Nurse Lulu sat by Gary's side in silent prayer, a moment of solidarity, not a plea for a miracle. Gary passed away peacefully, holding his wife's hand, dignified and at peace. Dr. Lee realized healing wasn't always about curing. Sometimes presence was the most powerful medicine. Gary's peace became a catalyst for change. The ward was never the same. Not everyone was convinced. Dr. Marcus Carver, head of oncology, believed in protocols and hard data. To him, anything unquantifiable was noise. He'd heard whispers about Lulu's quiet rituals and saw them as unprofessional. He worried prayer could give patients false hope or distract from real treatment. Determined to address it, he called Lulu into his office, ready to lecture her on boundaries. Lulu listened calmly, then spoke of her grandmother in the Philippines, who taught her that caring for the sick meant soothing the spirit as well as the body. "Doctor," she said, "when a person is scared and alone, sometimes the most important thing we can give is our presence. The prayer is for me, too. It helps me be fully present." Dr. Carver was silenced. This wasn't about proselytizing but compassion. He dismissed her, but a seed of doubt was planted. He'd won the argument on paper but felt he'd missed something important. That night he wondered if there was more to healing than medicine alone. Lulu's words lingered, challenging his certainty. The ward's quiet moments began to catch his attention. He started to notice the difference in patients touched by Lulu's presence. The line between science and soul began to blur. Dr. Carver's skepticism was shaken, if only a little. Sometimes the hardest hearts are the first to change. The revolution was reaching even him. Dr. Carver's turning point came unexpectedly. Late one night he passed the room of a young woman dying of leukemia. The door was ajar. Inside he saw Marco, a janitor from El Salvador, standing at the foot of her bed, head bowed in silent prayer. Marco wasn't a nurse or doctor. He wasn't seeking recognition. He simply offered a moment of presence to a suffering patient. Dr. Carver stood frozen, moved by the pure humanity of the act. This wasn't policy or protocol, it was compassion. The hospital, he realized, was more than machines and medicine. It was a community. The healing environment he sought wasn't just about efficiency, but about empathy. The next day, Dr. Carver found Lulu. He didn't mention Marco, but asked her to explain her approach, not as a skeptic, but as a colleague. He learned that the Filipino prayer technique was about deep, empathetic presence, not religion. It was about acknowledging the patient's soul as well as their body. Dr. Carver began to see the potential, not for miracle cures, but for profound comfort. In his quest to be a great scientist, he'd risked forgetting how to be a good healer. The lesson was clear: true care goes beyond medicine. The quiet revolution had changed him. He started to listen more, to see more. The ward felt different, warmer, more human. Sometimes healing begins with a simple act of presence, and sometimes it takes a janitor to remind a doctor what care really means. Change began quietly. Dr. Carver didn't make a grand announcement. He simply created space for what was already happening. He talked to other nurses, discovering Lulu wasn't alone. Many Filipino nurses practiced quiet, prayerful presence. They'd done it for years, often discreetly, because they saw its effect on patients' well-being. The first official step was small. Dr. Lee, with Carver's support, proposed a pilot program. It wasn't called a prayer program, but the Spiritual Support and Presence Initiative. The goal trained volunteer staff to offer quiet, non-denominational spiritual support to patients who wanted it. Lulu led the training, teaching how to be present, to listen, to comfort without words. The program's success wasn't measured in survival rates, but in patient and family feedback. Requests for chaplaincy and for nurses to simply sit with patients increased. Families wrote letters grateful for the peace their loved ones found. Data showed reduced anxiety, improved mood, and a greater sense of dignity. The culture of the ward began to shift. Doctors started asking about patients' emotional and spiritual states. Morning rounds included, "How are you feeling in your spirit today?" The hospital, once focused only on science, was making room for the soul. The quiet practice of a few Filipino nurses became a valued part of healing. The revolution was now policy, and the ward was transformed. News of Chicago's success spread. On the East Coast, Dr. David Monroe at the Manhattan Oncology Institute faced a crisis-top technology, but low patient satisfaction and high staff burnout. Intrigued by the Chicago model, he decided not just to copy the program, but to import the culture. He recruited experienced Filipino nurses, valuing their capacity for empathy. Some staff worried about integrating a non-scientific approach, but Dr. Monroe framed it as a study in compassionate care. He launched a research project to measure the impact tracking anxiety, pain medication use, staff turnover, and family satisfaction. The Filipino nurses brought warmth and a person-centered approach. They learned patients' stories, remembered family names, and offered quiet presence when needed. This wasn't a protocol, but an organic expression of care. Other staff began to emulate their behavior, seeing the effect on patients, a moment of peace in a day of pain. The soul of the hospital was rekindled. Data showed improved outcomes, but the real change was in the atmosphere. Patients felt seen, not just treated. Staff felt renewed purpose. The revolution was no longer quiet, it was spreading. Compassion became a clinical tool. The line between science and soul blurred further. Healing was being redefined. The hospital became a place of both cutting-edge medicine and deep humanity. The lesson: true care is both art and science. The movement spread nationwide. Hospitals from Houston to Seattle recognized the value of what Filipino nurses demonstrated, the healing power of presence. The focus shifted from treating disease to caring for the whole person, body, mind, and spirit. Nurses who once kept their practices quiet now felt empowered. Hospitals offered workshops led by Filipino nurses, teaching compassionate presence. The lessons were simple: listen actively, be comfortable with silence, offer support beyond words. Families became powerful advocates, sharing stories of how quiet prayer transformed final days. Personal stories proved more persuasive than any study. The movement faced challenges, but momentum was undeniable. Evidence, both anecdotal and data-driven, mounted. The quiet practices of Filipino caregivers resonated deeply in American healthcare. They answered a crucial question: how do we care for the spirit when the body is failing? The answer was simple, profound, and now impossible to ignore. As spiritual support became widespread, the scientific community took notice. Researchers at top institutions began studies to quantify the effects of compassionate presence. They measured pain, anxiety, depression, and even biomarkers of stress. Results were clear. Patients with spiritual support reported less anxiety, needed less medication, and families felt more supported. Studies distinguished this from intercessory prayer. It was about the emotional benefits of human connection. The key was presence, not religion. Filipino nurses, with their cultural emphasis on empathy, became models for this therapeutic alliance. The research validated what nurses in Ward 4B knew: caring for the spirit is essential to healing. Hospitals saw improved outcomes and lower costs. Training in compassionate presence became a cost-effective intervention. Science caught up to what caregivers had practiced all along. Healing the spirit was now recognized as part of healing the body. The revolution was now evidence-based. Today, the landscape of American palliative care is changing. Spiritual support is becoming a standard of care, driven by compassion, not technology. Filipino caregivers have been teachers and cultural bridges, showing that healing involves the spirit as much as the body. They reminded us that powerful medicine often requires no prescription, just presence. At the end of life, what matters most is not being alone. Science and soul are now seen as partners in healing. Hospitals are learning to nurture both body and spirit. The goal is not just to extend life, but to ensure it has dignity and meaning. The legacy of caregivers like Lulu and Marco is woven into the best hospitals. They started a conversation that changed how we think about dying and living. The ultimate measure of healthcare is not conquering death, but embracing humanity. Science gives us years in our life. Compassion gives us life in our years. The quiet revolution continues, one presence at a time.